Hello everybody and welcome back to Learnopedia. If you're new, my name is Ruhan and I run this whole channel. And from the thumbnail of the video, you probably would have guessed we're going to be talking about recovery strategies of and from COVID-19. But remember, this is going to be both at an individual and a societal level. So without any further ado, trigger intro. If you've been watching my past videos, you know that I always include a timestamp or a plan of the whole video, and here it is for today. So first we're going to be looking at COVID-19, a strand of coronavirus, from a biological perspective and also the impact it has caused on the world. Then we're going to look at some viruses that at a mathematical and a biological level match with the COVID-19, and also some other pandemics from the history which have caused similar impacts as the coronavirus. Using all that information, we're then going to make a conclusion, our next part. First of all, using all that information, we're going to look at how to stay away from coronavirus as an individual. After completing that, we're going to move on to learning how to get cured or recover after getting infected from the virus. Then we're going to move on to the societal level, in which I'm going to talk about different strategies that countries can use and are using and the reasoning behind it to eliminate coronavirus from their system. As you guys probably know, when you're sitting in quarantine watching this video, the COVID-19 is a part of coronavirus which originated back in the December of 2019 and the beginning of January 2020. Well, the COVID-19 is a negative strand RNA gene. That is somewhat similar, up to 96% similar to a beta coronavirus. And a beta coronavirus is the same virus which was responsible for causing the SARS epidemic 2002-2003 in the Guangdong province in China. Well, however, there's a catch. The SARS epidemic and beta coronaviruses do not have the capability of spreading at such rates as the COVID-19. However, they are a bit more deadly. If you compare the death rates of COVID-19 versus SARS, you'll find a big difference in percentages. Also, if you see the R number of coronavirus, R number being the common ratio of spread, you probably learned that in geometric sequences, and compare it to the R number of SARS, you're gonna find a big difference, because as of me recording this video, there are like about 2-3 million cases in the world, and I'm not sure if that's going to be the case because the cases are growing exponentially. So now back to the topic of genomes and how this virus originated, because if we want to recover from it, we need to know what it's made of and what it's capable of. The COVID-19 has a 96% similarity to the genome of beta coronaviruses, and beta coronaviruses is a family of viruses which are found in bats and can be mutated into humans. However, there is also been seen some similarities, not some similarities, very significant 99% sRNA similarities to the pangolin virus, which is also found in China. The sRNA is mainly responsible for the spread of the virus and also the way it enters the human body. So as you probably would have known, and you probably see a lot of TV ads, a lot of articles, the coronavirus mainly enters the body through an open source. It cannot go through our skin. It uses our mouth, it uses our nose, it uses our eyes, sometimes even uses our ears, but more popularly these, and if you have open cuts, it can enter through that. The COVID-19, similar to SARS and beta coronaviruses, is a respiratory disease, but also, like the pangolin virus, is capable of much deadlier consequences such as organ failure. However, it's very much treatable compared to the SARS epidemic because it was so concentrated and so precisely killing the lungs in ways which our bodies wouldn't be immune to, except for some people who survived it. This virus, however, is not that deadly at first, but so if not treated properly, it can cause organ failures of organs such as your lungs, your heart, your kidneys, which is very essential and can lead to death. According to the summary, we can see that the coronavirus is a deadly mixture of both crazy organ failures, but it also is very good at spreading itself and multiplying between people because it's a negative strand. And that takes it a long time to start transferring RNA messages into our DNA, but when it does, because of it being a 15 genome virus, it can multiply rapidly and infect multiple people compared to the other viruses we have seen in history. This is the second segment of the video, hence we're going to be talking about similar viruses to the COVID-19. As mentioned previously, this is a very important step towards the recovery stages, because to recover from something or to defeat something, in other words, you have to understand it. And establishing comparisons with previous things that we have experienced is a good way of understanding something. So from the research I've done and the news channels I've watched over the research period for this video, there are two main viruses which most researchers and journalists are comparing this pandemic to. Number one is the SARS epidemic in Guangdong, mainly being because it comes from the same beta coronavirus family and it causes similar sorts of damages to the human body, and it has a similar way of killing the human being. Another virus is pretty interesting because it's a pandemic from 1918, and yes, you guessed it, this is the Spanish flu pandemic, otherwise known as the deadliest virus in human history. So why do they compare these two viruses to the coronavirus? Well, two reasons. The SARS, on one hand, as mentioned previously, reflects or mirrors the way COVID-19 kills a human being, or in other words, it damages a human being. On the other hand, the Spanish flu, the 1918 flu pandemic, mirrors the way COVID-19 spreads, and it mirrors how it transmits from human to human. And first, let's start by talking about the flu pandemic, because the main part of COVID-19 that we want to counter is its quick spread, because the mortality rate in COVID-19 is less than 3% during all times. Doesn't matter the day, it's always less than 3%, which is very minimal and ignorable. The other 97% of the people are getting cured. So the fact that so many people are dying does not really reflect the deadliness, I don't know if that's a word, of the virus. It reflects how quick we're allowing it to spread. So in the Spanish flu pandemic basically happened in 1918, and it was the year of the World War I, and most countries had signed this commission saying that they would not release any information which could impact their performance in the World War and which could cause some retreating and other sorts of problems. And this was the case in countries like America, the UK, other involved countries that were involved in World War I, which became the victim of the Spanish flu to see so much loss and so much spread. However, the reason why it's called Spanish flu, by the way, is because Spain was the only country, not the only country, but the country which was explicitly informing its citizens about the virus and actually conveying the real statistics. So what happened during the flu pandemic was that by the time people realized that it was a virus, it was a bit too late, and we as human beings did not really have the understanding of the whole pandemic system. And that caused a lot of panic, a lot of gathering, which was like inviting death to your doorstep due to the amount of people that were infected. There were so many groups and gatherings, especially around hospitals and parliamentary buildings, and caused mass infection of people, and a lot of them died because, again, there was no real solid cure even for a normal flu. But the Spanish flu, I believe, killed over now, talking about the second aspect of the COVID-19 being the SARS epidemic back in 2002-2003. Well, both viruses are very similar because they attack your lungs. However, the COVID-19 is slightly a bit more dangerous, but surprisingly does not really kill percentage-wise as many people as the SARS. The reason being, SARS strongly, like really strongly, attacked the human's lungs and caused things like severe pneumonia and bronchitis, severe bronchitis, and prevented the human being from breathing and taking in pure and good air. And the COVID-19, however, does not really strongly attack one's lungs. However, if it's left in the body for too long, it can cause massive organ failures of organs including the kidneys, the heart, and lungs, which are very essential and can still be very deadly. As said before, right now we're going to be talking about how to stay away from the COVID-19 as an individual. Yeah, that means you. You would have seen a lot of flyers, posters about washing your hand for 20 seconds and all that sort of stuff, and cleaning your face every time, using hand sanitizers. Well, let me tell you the truth. That's all necessary. You have to stay away from people, self-quarantine, maybe even quarantine yourself in your house for some time, especially if you get sick. Don't really stay with your family that much because you risk infecting them. And if you are sick, most doctors and researchers suggest that you stay 14 days in your home with your mask on and self-quarantine. If the sickness doesn't go away, be sure to contact the doctor because you might be infected with COVID-19. I'm not saying that's the case, but if the symptoms show fever, cough, breathlessness, and other chest pains or any other sort of coronavirus related symptom, wait for 14 days. If the sickness does not go away, contact the doctor immediately. However, why do you have to wait for the 14 days? That's because the coronavirus is, as mentioned previously, not as deadly. So it's very highly possible that your body can actually eliminate the coronavirus by itself without need of any antibiotic or any medicine assistant, which is going to be great. You're going to be immune to the virus itself and it's good for you. But if that does not work, you go to the hospital. There's no need to be scared because I've also read some articles about mental stress affecting the death rates of people and how mental stress can actually impact our immune system and the way it fights viruses, and mental stress can actually cost people their lives in this case, kind of scenario. So the only 2 or 3 advices I have for staying away from the virus at an individual level is to just quarantine, hygiene, like keep your hands washed, wash your hands for 20 seconds because the protein layer around the genome of the virus requires at least 20 seconds of alcoholic wash before it fades away, and then it does not have the capability of entering you. Don't touch your face because the virus normally enters from open parts of your mouth or your body, and don't touch your cuts or any open blood areas, clots that you have on your body. And the last advice being just self-observe. If you have a sickness, if you just have a cold, I don't think it's need to worry. Just keep checking your fever for 14 days after you get diagnosed with the cold and or fever or shortness of breath, and see if it goes away after 14 days. If it does not, go see the doctor immediately. Now, you might be asking, what if someone gets infected with COVID-19 and how does all that sort of things work? So, first of all, if someone gets infected with COVID-19, as mentioned in the previous segment, it's just going to show some normal flu or cold symptoms such as cough, fever, breath problems. So every doctor, I think, recommends, or research recommends, to stay self-quarantine yourself for 14 days. This will mean that if it's a coronavirus, it would start speeding up and your symptoms will be heavy, and you'll know when to go to the doctor. And it's very essential to do so. But before that, your body can actually develop immune systems and some specialized RNA molecules to actually eliminate COVID-19. And multiple people around the globe have done that, and we don't even know about it because it's not really possible that everybody who gets infected with COVID-19 actually comes to the hospital, gets checked, and gets treated there. Now talking about the inside hospital experience. So there are two things you can do to speed up your recovery and guarantee it. Number one, mental stress. Mental stress can actually impact one's immune system and its ability to produce white blood cells to eliminate the virus. However, COVID-19 is a little bit different, and it really hacks into our cells and makes them go infect other cells, but our body still needs the white blood cells to be produced and fought against before it grows, and the white blood cells actually start self-destroying the organs, which is very serious and needs to be treated in hospitals using either antibiotics or some other vaccines and remedies. Example, I think the most popular drug that's being used for the treatment of COVID-19 is probably hydrochloroquine. It's also a drug that was used to treat malaria, and it's somewhat similar to the virus. And that, I think you guys need to search, because this video is only about the recovery process. The second thing you can do to speed up your recovery in hospital is cooperate. That happens, hopefully does not to you, but if that happens, don't be sad, because mental stress all goes around in a paradox. And don't be mentally stressed about it, just follow what the doctor says, and there's a 97% chance you'll recover. The odds are too low against the death part that I don't think anyone who gets infected with COVID-19 needs to worry, unless one has some chronic lung disease or heart disease, which can be somewhat harder, but it's still possible to recover. Because I've seen news about people that are aged at near 100 or even over 100 beating the COVID-19, and I'm pretty sure anyone around that age normally has a chronic heart or lung or even a kidney disease. And this shows you how this virus is not deadly. It's just about the mental game and just about cooperation. So yeah, finally, this is the last segment of the video. Now we're going to be talking about how to treat coronavirus at a societal level. By societal, I mean either as a state, as a country, even as a city, or as the world as a whole. There are two main strategies which can be used to flatten the curve. Let me explain what that means, because viruses like this are very incubational. Like, they rely so much on spreading to people that it's not really more important about coming up with a cure. It's more important about slowing down the infection rate so our hospital can handle each patient with the required amount of time to treat them and get them out of this problem. So basically, for a virus like COVID-19, either the graph of the total current infections in hospital would either look really symmetrical or really positively skewed. And what we want to do is flatten it out. There is one way if your country is highly populated, city is highly populated, but other countries or cities which are not very highly populated, there is a second way to achieve elimination of COVID-19. So let's talk about the first one. Yeah, you guessed it, it's societal quarantine. So these actions have been taken out around the globe, and most countries have had a positive impact from them. It has slowed down skew by so much. Some countries are having very negative responses towards this kind of self-quarantine because of the economic impacts the virus is causing. But I personally think that as of right now, if we think about economics, people's well-being and healthcare is going to be diminished, and it might even result in a bigger economic loss if looking at the future, considering that not many people are going to be contributing. Hopefully they are going to be contributing. So I personally think economics should be not a topic of discussion at this point in time, because it's not only a country's problem, but I think the whole world economics is going down at the same time. So quarantine is probably the best option for an overpopulated or just a populated city, state, or country. This allows the infection rate and the R number to slow down by significant amounts. It will flatten the curve of cases. Now the second one is very interesting, and after research I found out countries, especially Scandinavian countries such as Switzerland, have been using the method. It's the method of mass infection. Well, yes, you might be like mind blown, but this is actually a valid cure. So in Scandinavian countries such as Switzerland, the economics is well spread out into health and all the hospitals. The population of Switzerland is, for example, let's say if the whole of Switzerland was to get infected from COVID-19, or any other Scandinavian country was to get infected with COVID-19, the hospitals would only be a little overwhelmed, which is basically represent contrast to some countries like China, let's say, because China recovered drastically and amazingly from the economic drought and also the COVID-19 just by performing quarantine, because the population is so much and you can only build so many hospitals that you wouldn't be able to store as many patients. However, if you mass infect people in a country with small population, good healthcare system, you'll be able to treat all of them, or at least, because there's a 2% or 3% mortality rate, only 2 or 3% of the country's population has a chance of dying out, and the others will build immunity to it. And the immunity means if there's another wave of COVID-19, actually those countries are completely safe from it. That's actually a valid way of fighting and recovering from the coronavirus, and it's very surprising, but it is certainly a valid strategy, and it's, as far as data speaks, as of right now, it's actually been working. Some countries that are failing to attempt any of these strategies are well being reflected on numbers, and the number of their cases and the number of their deaths, mortality rates all scream out the same thing. There needs to be at least one of those recovery strategies in use. Everybody, thanks for watching the video. That was all of the recovery methods that I came up with and researched about the coronavirus. Thanks for watching the video. If you liked it, hit the like button, subscribe, and turn the notifications on. See you until next time, and stay safe from the coronavirus. Bye-bye.
Tell me pretty lies, look me in the face, tell me that you love me, even if it's